Welcome to this beautiful day here in northern Michigan. My name is iraqi. I'm a physical therapist at Superior Physical Therapy, where we are the shoulder pain experts. And I'm here today to show you and talk about the top 3 movements that you can start to do on your own to help your shoulder come out of pain. Now, this is a very general topic because we know there's a lot of reasons someone can have shoulder pain. Rotator cuff tears, labral tears, impingement, inflammation. What I'm going to show you is what I see as the 3 most common limited motions and that you can start to work on. The first thing we want to talk about is how most people don't realize, but the hips are a very big friend or helper of the shoulder. And if you think about it, that makes sense. I used to play baseball, and one of the things that would be very obvious would be, as a center fielder, I would throw the ball, and I could throw the ball all the way to home plate with no problem. Now, if you made me sit on my butt and I tried to throw that ball to home plate, good luck. I might be able to get it to the second baseman, and you ask yourself, why is that? Well, when I'm sitting, my hips can't help. When I'm standing, my hips can help, and I'm more powerful. So we know that the hips are a huge influence in the shoulder, and I can say maybe 90% of the time, in my experience, when somebody has shoulder pain, they also have hip limitations. So what we're going to do here is an activity that involves 3 motions that gets the hips moving with the arm. Now, I'm going to show you this through the full range of motion, but by all means, you do what feels comfortable to you, and even a little bit of motion in these directions is going to be beneficial. The first motion that we see that's limited in the shoulder with people very commonly is reaching up straight up overhead. Okay? Now, what we're going to try here, we're going to try to reach up overhead, but we know that before we can go up, we must first go down and back before we go up. So we're going to start that motion. I'm going to go back and then up, back and up, back and up. And each time, I'm going to try to increase my motion in my shoulder. Now, if I get to a point where that hurts right there, I'm going to probably stop right there and then just come right back. But if I can get up here and there's no pain, I'm going to keep that motion going. But please focus on my hips. As I go down, my hips bend. As I go back, my hips go forward. I'm going to try this for about 20 repetitions. Okay? Assuming my right arm is the one we're focusing on. Now, the second most common motion is going to be the arm going up to the side. Very common for someone to have pain reaching up to the side overhead. We know that before I can go this way, I must first go this way. So I'm going to take my hips, I'm going to reach down to the left, shift my weight to my hips, and then come up. Reach to the left, come up. To the left. Now, if I can get all the way up here, great. If not, just go to where you feel comfortable. I'm going to try this motion 20 times. Okay? Now, the third and final motion for this exercise, we have a very commonly someone reaches back, there's pain. I'm going to take this here and put my right foot forward. I'm going to reach left, then I'm going to reach right. Reach left and reach right, trying to get my hips to turn as much as possible. If I need to keep my arm a little lower, great. Now, phase 2 of this, I might put some small weights in my hands, but right there, my body has to control my arm weight. That's going to be enough to get started. Now, the second part here that we see very commonly is somebody having poor stability of the shoulder. So I'm going to get on the ground, and we're going to use the ground and our body weight as our assistance. Okay? So I'm going to put my hands on the ground. The first thing I'm going to do is I'm going to shift my body weight front to back. I'm going to try that 20 times. If that goes good, great. If it goes good, in fact, the third exercise will be good for you as well. Then we're going to try shifting from side to side. And then the third and final one is going to be going around in circles to the counterclockwise 10 and then clockwise 10. So that is number 2 exercise to get the shoulders mobile and stable. The third one is my favorite. We call these arm drivers. If my right arm is the one that's a little sore, I'm going to keep that right arm on the ground. I'm going to take my left arm and reach out. I'm going to try this 10 times. The second motion, I'm going to reach to the side. And the third one is very, 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 very important. I'm going to reach under and then reach all the way up. 10 to 15 times. Those motions, exercises are going to create mobility and stability in my shoulder joint. And as long as I take it in a in a pain-free range of motion slowly, I try that 2 or 3 times a day. Over a 2-week period, I should be able to make some progress. Now, keep in mind, there are a lot of other parts of the body that can cause shoulder pain, and this is just very general, so it's a nice start for you. If it's not working for you, don't give up hope. If it's making you worse, stop. But if it's not helping you, don't give up hope. You know, there are solutions for you that are natural, that that include no surgery, injections, or medications. And I would encourage you to call a physical therapist. We are the shoulder pain experts. Our number is 231-944-6541, and we'd love to take a look at you.